Pharynx. This is an unpaired organ situated in the region of the head and neck. It is a part of both digestive and respiratory systems, fixed to the base of the skull. Length of an adult pharynx is about 12 cm. Location. 1. Upper part, vault of pharynx, attaches to 2. Pharyngeal tubercle of the occipital. 3. Sides of pyramids of temporal, in front of external carotid opening. 4. Medial lamina of the pterygoid process. 5. Bottom part. 6. Continues into the esophagus at the level of the C4 vertebra. 7. Behind the pharynx. 8. Prevertebral muscles. 9. Prevertebral lamina of cervical fascia. 10. Cervical part of the spine. 11. Between pharynx and the fascia. 12. Is the retropharyngeal space with retropharyngeal lymph nodes. 13. On the sides. 14. Pharynx is joined by the internal carotid arteries, vagus nerve, internal jugular vein, greater horn of the hyoid, thyroid cartilage of the larynx. 1. Anterior wall openings. 2. Opening of choana present. 3. Below them is the fauces. 4. Below fauces is the opening into the larynx. Pharynx is divided into 3 regions. 1. Nasopharynx behind the choana, part of respiratory system. 2. Oropharynx between palatine velum and entrance into larynx, only a part of digestive system. 3. Laryngopharynx between entrance into larynx and beginning of the esophagus. On superior posterior walls there is an accumulation of lymphoid tissue. Pharyngeal tonsils on lateral walls next to inferior nasal concha. Opening of pharynx into auditory tube, Eustachian tube, connects to the tympanic cavity. It equalizes pressure of the middle ear with atmospheric pressure. Next to each opening of the auditory tube lies the tubal tonsil, an organ of the immune system. Entrance into larynx is bordered in the 1. Top by the epiglottis. 2. Sides by the aryepiglottic fold. 3. Bottom by the arytenoids cartilage. Wall of the pharynx consists of mucosa, a thick submucosa, muscularis and adventitia mucosa lined with pseudostratified ciliary epithelium. Submucosa in the naso and oropharynx region is thickened to form a fibrous plate called pharyngobasilar fascia. At the level of the laryngopharynx, the submucosa has a large number of glands. The mucosa has 5 striated muscles, 3 pharyngeal constrictors and 2 longitudinal elevator muscles. Pharyngel constructors. First muscle, superior constrictor muscle, origin of medial lamina of the pterygoid process, pterygomandibular lig. Mandible and root of tongue and insterion into posterior side of pharynx, joins with same muscle on opposite side, and function is constricts the pharynx, narrow the lumen of the pharynx, and innervation is branches of pharyngeal plexus. Second middle constrictor muscle, origin of greater and lesser horns of hyoid insterion into posterior side of pharynx, joins with same muscle on opposite side, and function is constricts the pharynx, narrow the lumen of the pharynx, and innervation is branches of pharyngeal plexus. Third inferior constrictor muscle, origin of lateral surface of thyroid and cricoids cartilage and function is constricts the pharynx, narrow the lumen of the pharynx, and innervation is branches of pharyngeal plexus. Longitudinal phryngeal elevators. First stylopharyngeal muscle, origin of styloid process of temporal and insertion into lateral wall of pharynx and function is raises the pharynx up and innervation is branches of glossopharyngeal nerve. Second salpingopharyngeal muscle, formed by the palatopharyngeal muscle, refer class 1. Note, origin of inferior surface of cartilage od auditory tube and pharyngeal opening of it and insertion into lateral wall of pharynx and functions are raises pharynx up and laterally and innervation of branches of pharyngeal plexus.